Namaste, listeners, viewers, and today I, Dr. Colonel M. Sitaram, I am going to introduce a good friend of mine to you. She is Dr. I. Bharani, the consultant in gastroenterology at Apollo Hospital, Secunderabad. Gastroenterology is a slightly newer branch of medicine which has taken our understanding of the diseases of the stomach and liver and everywhere to a new level, and they have made so many new developments that many patients who are otherwise would have been missed in the diagnosis or undertreated, they are now getting a benefit. Welcome, Dr. Bharani.
Thank you, sir.
And today you must tell our audience how this gastroenterology is different from general medicine. So many days all we were physicians were treating medicine,
Right.
stomach diseases.
Right. So as you said, gastroenterology is a comparatively newer branch in the field of medicine. Gastroenterology basically it's a super specialty. A specialty branch which deals with diseases of the GI tract, gastro and intestinal tract. So what is the difference between us and the physicians is like we go a step ahead and treat the disease of the GI tract with other interventions like endoscopy, namely maybe disease of the lower intestine, that is a colon with lower GI endoscopy, and we deal with other diseases like disease of the liver which can present with jaundice. We do have interventions when they have stones causing jaundice with special procedures called ERCP. In that way we differ from the physicians.
Yeah, as we understand, gastroenterology means the entire tract through which our food passes, right from the mouth to the last end of the body, and in between, of course, there are many important organs in the stomach, the liver, spleen, various other things. All of them do cause discomfort at times, trouble at times quite a lot of emergencies also. So gastroenterology is a super specialty which has grown out of the need for urgent attention to these particular diseases. Now, what are the common symptoms with which patients come and talk to you?
So the most common patients we see in our general practice is a patient who comes with saying he has increased gas or indigestion, what we call in a common man term.
Or the flatulence, they call
Flatulence
it. Fullness.
Fullness, that bloating.
Bloating
Medically
sensation,
we call it as dyspepsia.
Dyspepsia.
So that is the most common symptoms with which the patient comes to us. Other rare things like they can present with pain, vomitings, sometimes blood in the vomiters,
Wow.
constipation issues,
Okay.
increased flatulence as you just said, blood in stools, and any presence of jaundice, decreased appetite, any presence of weight loss which might be related to the gastrointestinal tract. So these are the other constellation of symptoms which the patient can come with.
So we find so many symptoms attributable to the abdomen in general.
Yes.
But some are due to the diseases of the organs,
Yeah.
whereas some are due to the diseases located elsewhere,
Yes.
and their patient is feeling the symptoms here.
Exactly.
Can you tell us what are the causes of this dyspepsia?
Yeah, causes in the sense most common causes are related to the GI
GI
itself,
tract.
but there are certain other diseases as well. For example, a patient with uncontrolled diabetes can have digestion issues. A patient who has renal issues can also present with indigestion issues, and any presence of any neurological causes which can lead to headaches, and then the patient can come with vomitings. So these are the other systemic illness, other disease of the other organs which can affect the GI tract. For that matter, any disease anywhere in the body first upsets the stomach.
Yeah, that we understand that most of the diseases show their first manifestation as stomach, and attention of the doctor might sometimes go to the stomach, and whereas other things are missed. So a good gastroenterologist should have an overview of the patient as well as know the exact anatomy and physiology as well as the function of a particular organ in the body. Now, are there any situations where they should make a beeline straight away to the gastroenterologist? Is urgent indication to run and see gastroenterologist?
Yes, there are. When there is unremitting vomitings first.
Severe vomitings.
Severe vomiting.
Intractable vomitings.
Yeah, intractable vomitings and severe abdominal pain which is intolerable, and any presence of blood in the vomiters.
Right.
Yeah. and any passage of blood in the stools. Motion. That's mostly it will be like black colored stools sometimes.
Right.
It can occur. There can be fresh blood in the stools. And any sudden unintentional weight loss occurring without any reason. These are the situations which can be called as alarming signs. So these are the symptoms which needs attention of a physician. Yes.
And I think I might add, a lot of children put stuff in their mouth and swallow foreign bodies. I think that's very, very
you are right,
important.
actually. Yeah, presence of a foreign body, ingestion, foreign body ingestion is an emergency for which the patient will immediately require a gastroenterologist consultation for that removal with an endoscopy.
Yeah.
So that is an emergency.
There are a lot of new gadgets which have entered medical field, and the most interesting ones are the ones which have been practiced at gastroenterology. For example, the gastroenterologist system, earlier you could only see an X-ray of the abdomen. The ultrasound is an abdomen test which you can do. But so many new things have come. Can you kindly tell us what are the investigations you can do to arrive at a diagnosis?
Yeah, first thing foremost will be the clinical examination.
Clinical examination, like what you've done in the past.
So clinical examination of the liver, any presence of enlargement of the liver, enlargement of the spleen, presence of any masses in the abdomen, and any masses in the neck, and signs of jaundice present with yellowish eyes and severe anemia which shows in the tongue and in the pale skin and all, any presence of edema in the swelling of the feet which can suggest a liver disease. So these are the signs which we need to first rule out, examine and rule out. And next, as you said, just go for other, apart from the routine blood tests which diagnose specific conditions, we definitely need an ultrasound scan to look at the liver, look at the gallbladder, pancreas, and the other rest of the things. Apart from that, which are specifically related to the GI, these are the things which a gastroenterologist would want to look at. After this, the next level of investigation will be like just to see what's happening based on the patient's symptoms. Suppose the patient is having a blood vomiting. So we would definitely want to do an endoscopy.
Where is the blood coming from?
Yes. So we would definitely want to do a gastroscopy, endoscopy in the sense through which a tube is passed into the oral cavity, sent into the stomach, and the whole of the stomach will be examined to find out the source of the bleeding.
Does the patient need to be hospitalized or anesthesia has to be given for this?
Sometimes. Suppose if there is too much blood loss and the patient is unstable, definitely the patient
Otherwise
might
in
require.
outpatient procedure.
Yeah, it can be done in an outpatient procedure also, as an outpatient procedure.
And how do you take care of the pain of this?
Yeah, definitely. Generally for endoscopy, a local anesthetic is more than sufficient.
Oh, good. That's
but
nice
in an apprehensive patient, and especially in children who can't tolerate a procedure, we definitely want to sedate the patient completely, anesthetize, and then do an endoscopy, which is much more safer.
Lovely.
So, and the endoscopy will hardly take 2 minutes time.
Wow.
If everything is normal.
2 minutes you can see the entire stomach,
exactly. It can be finished.
No,
It can be finished. And if they see something abnormal, suppose a tumor, let us say, which is bleeding, we would want to take a biopsy of the tumor and stop the bleeding with special equipment which we have, like clipping and spraying something on the blood so that the blood clots. And if we see swollen blood vessels which have ruptured and caused the blood vomiting, we would want to stop vessels with special band-like thing or inject a special chemical. So these are the few things which accessories which we use to stop the bleeding. Suppose if that is the cause for that.
Okay.
So sometimes the patient can have difficulties, swallowing difficulties and all. So we would want to see the food pipe, that is called the esophagus. So disorders of the esophagus they also come under gastrointestinal diseases only. We would want to see any obstruction going on in the throat and the food pipe, and any muscle abnormalities, abnormal peristalsis, abnormal relaxation and contractions of the muscles, which can lead to patient symptoms. And as you said, we just discussed presence of any foreign body, most commonly coins in children, and any other thing, we would want to just remove it with endoscopy.
That's nice to hear.
Yes.
What about the lower intestines?
Lower GI is like, actually if we divide the gastrointestinal tract, it can be roughly divided into 3 parts. The upper GI, lower GI, and the middle gastrointestinal. So the middle part contains of small intestine that is almost 5 to 6 meters long. And the lower that is the colon, large intestine, it is about 1.5 meters, which can be seen clearly very as easily as in an upper GI with a lower GI endoscopy, what we call is a colonoscopy. So in a colonoscopy, we will be able to see any diseases, any bleeding, any presence of any ulcers, tumors, strictures, anything in the colon itself. So any presence of any hemorrhoids or piles or fissure, any fistula, anal fistula occurring can be clearly seen with the colonoscopy.
Lovely. So just to put it into perspective, when a patient comes to you, you're going to take a proper history, whether
Right.
there is any history of jaundice or what type of
Right.
pain. Then you're going to examine and see whether liver enlargement, spleen enlargement,
Right.
any failure, liver signs and all.
Right.
Then you are going to perform an upper GI endoscopy with a tube passed inside
Right.
and see, visualize from inside, stomach, intestine, duodenum, and then maybe if required, maybe a lower endoscopy and look for colon or all various other organs.
Right.
Am I correct?
Right.
And what are the other things we can do apart from diagnosis? Can you also intervene urgently and treat some emergencies in the gastroenterology department yourself?
Yeah, yes. Actually, emergency in gastroenterology will be mostly a bleed.
Bleeding.
A bleed or blood vomiting, hematemesis medically called. So that can be diagnosed with a gastroscopy, and if it's an ulcer bleed, we immediately stop the bleed with accessories available. That can be easily passed with the endoscope channel only, and that bleeding can be immediately stopped. That we can do. Suppose we have seen a bleeding coming from a swollen blood vessel, that can be expected in a liver disease patient, we call it varices. So that is one of the most important emergency, most critical I can say. So that needs to be immediately stopped by blocking the blood vessels with a special this thing, we call it a ligation or banding.
Banding.
Banding, yes.
Tying up the
Tying up the blood vessel and just
bleeding.
blocking the whatever leak is there. So that is another thing. Apart from varices, ulcer bleed, and we sometimes do see tumor bleed. Suppose a patient has a cancer cancer in the stomach, which can sometimes bleed and cause symptoms. So in that case, we would definitely want to stop the bleed with again those special whatever instruments we have with it. We can definitely stop the bleed.
Okay.
And to diagnose also, sometimes the patient comes with, let us say, severe unrelenting vomiting, which when the patient can't even tolerate a normal liquid diet, we would definitely, in that case also, the patient gets dehydrated, he loses all his salts in the body and he comes with hypotension. Then in that case also, we would definitely want to diagnose, rule out any obstruction going on in the stomach. Most common cause will be like a tumor.
Right.
So we would definitely want to rule out that. For that also, endoscopy is very useful.
Lovely. Frequently we've been hearing a new term called capsule endoscopy.
Yes.
What exactly is this capsule endoscopy?
Capsule endoscopy is actually a very good invention in the last couple of decades, where we can easily diagnose diseases of the small intestine. So like I just said, we can see the upper GI, that is the esophagus, stomach, through a gastroscope. We can easily reach the total colon up to the cecum. The total of the large intestine can be seen through a colonoscopy. Earlier days, the small intestine was considered as a blind tunnel, so it can't be reached that easily. So we all of us used to rely on X-rays, barium series, where which we give contrast and look at the small intestinal pattern, take X-rays, and after that came the CT, where they're still being done, CT enterography and all, to just highlight the intestine, small intestine. So capsule endoscopy is the one which can definitely diagnose diseases of the small intestine.
Small intestine.
Suppose many a times we see patients coming with a bleed. They say they bleed from the stool, but then when we do an endoscopy and colonoscopy, nothing will be found.
Okay.
So the source will be from the small intestine.
Small intestine.
So to diagnose those, the capsule is the one which is now in use.
Very good.
Yes.
And I think now we have diagnosed a condition.
Okay.
Let us talk something about the long-term treatment. When he leaves your room, what are the things you tell him about diet or any other things that you should avoid? So kindly let the audience know what is your approach to dyspepsia.
Yeah, dyspepsia is like indigestion, as we just discussed. It's a total constellation of symptoms which can present as, the patient can say he has abdominal pain, bloating, tightness, that frequent burps, the most common thing which we see in reflux disease and all, and not eating, less appetite, constipation, and rest of the things. So generally although no specific diet is directly related to as causative of these symptoms, there are certain foods which do trigger these symptoms. The most common of these will be like too much of fried and oily items.
Okay.
Oily foods do trigger dyspeptic and reflux symptoms. So these needs to be avoided. Too fast eating and overeating. So these are the other two things which needs to be avoided. The other thing, and the other one will be like using too much of painkillers.
Oh,
Using painkiller can lead to dyspepsia and ulcer formation.
right.
And citrus fruits like oranges, grapes, lemon, so other berry fruits. These are the one which contain too much of citric acid.
Oh.
They can also trigger those
Oh,
symptoms.
I didn't know that.
Yes.
So even ordinary fruits which are so think were very
Yes.
healthy food,
Yes.
and everyone pops in a
Fruits,
grape
exactly.
or orange.
Yeah.
They also causing gastritis.
Exactly.
Oh my God.
So
Okay.
they do increase the gastric issues and acidity, whatever. So
Okay.
already if a acidic stomach receives an acidic item,
Yeah.
those symptoms are definitely going to trigger.
Nowadays, anyone having tummy upset, they just go and buy an antacid
Yes.
or a PPI drug,
Right.
which is to reduce the acidity off the counter.
Right.
And they will carry on for many
Many
decades.
years together.
Is it correct way to see a case of
Yeah, one-
dyspepsia medicines
Yes.
by themselves?
Yes, sometimes, but then if it's a short duration of symptoms which is getting treated, let us say a short duration in a young patient who has definitely has a history of something which is really triggering his symptoms. Let us say he has gone traveled and he has eaten outside food and all. So we expect a normal infection to be occurring in the stomach, maybe due to that infection or anything. So in that way, a few days trial of medications can be done with the over-the-counter medications which are available in the pharmacy for like antacid, the Gelusil tablets and syrup can definitely be taken. They are safe enough. But then if the symptoms are recurring again and they are prolonging,
Persistent or recurring
yes,
symptoms?
recurring symptoms, and with other alarming signs as we just discussed, presence of total loss of appetite, persistent vomitings, weight loss.
Weight loss. Isn't
Yes,
it?
that is the symptom. So in that case, I think there is an urgency to meet the doctor.
Very good. So I think we got an overview of the whole thing. Now we have got a large segment of our audience who are young,
Right.
who are overworked because of their stress at the job, who have got late working hours,
Right.
whose food timings are totally go wrong. So what are the precautions that they should take? Kindly tell us.
Right. So the thing is, this today's lifestyle, it's unavoidable. Like
Stress.
Yeah, that stress and all. It's just I can't. I mean, there's no. I mean, that is nothing is given in the books. Like what to deal with a night shift patient and a night shift person who does night shift. That is unavoidable. But then, few things do help these symptoms so that this totally can be avoided. Worst and most thing is like we have to find out what is the trigger factor. So what is the thing which is causing the digestion issues, whether it's the food, whatever the erratic food habits they have, if they have to avoid that. Whether the stress is the causative of these symptoms, be it physical or mental stress. So physical stress, it can be managed, but mental stress, psychological stress, they have to find their own ways, take help, do meditation, relieve the stress in various manners, whatever exercising or just meditating, and whatever the stress is, they have to find the root cause of the stress that they need to avoid. And food, as we just discussed, avoid those foods whatever are triggering their symptoms, too much of oily foods, junk food, this fast food, and mostly this refrigerated items, that carbonated beverages. Many times we see patients, they get relieved after drinking a soda. But then soda might give us a burp and relieve the symptom, but then it is going to worsen the symptoms because of the caffeine content present in that. So better thing is like the best is to avoid carbonated drinks, eat lots of fresh vegetables rather than fruits. We just spoke that fruits are also a causative factor for the things. So all vegetables, too much of sabji, include too much of sabji in your diet. And other thing most important for these people is like it's best to practice small frequent meals. That is a very good option available actually. If not 3 meals a day, you can split your meal into 6 meals and just take little by little quantity. That will help with their bloating, indigestion, and all these gas issues will settle.
In Hyderabad, we got a culture called the Bandi food stall culture.
Right.
They are very, very popular all over the time. Every time, round the clock, the sizzling oil is there,
Right.
and lovely snacks prepared. It's
Right.
very popular with our night shift people, as well as a lot of migrant laborers who are coming in lieu of normal food, they are eating that. What do you think is the effect on the stomach on all this?
Yeah, definitely that is going to increase these digestive issues actually. So I can't ask or
Just a moderation once in a while,
Yeah,
for the
once in a
taste
while
part
is
of it, but
better.
should not be every day or
every day.
evening.
Should not be a regular thing.
Right.
Once in a while, everything is acceptable.
Yeah.
But then, as far as possible, especially when these symptoms are there, so better to avoid those things. For every food to avoid, there is a time gap should be taken, like a 3 months time gap should be given.
Okay.
So just to retry it and see that whether that is the causative of the symptoms.
And another thing is IT companies, information technology, to keep awake or as a socializing, you're using coffee, tea. More and more, all the time coffee is brewing. What do you think about that in a regular
That
person?
also is one of the reasons. So coffee, tea, chocolate, garlic and oily fatty food.
Along with stress.
Yes, these
That's
are the things which are scientifically proven to increase the
increase the
dyspepsia and
upper
GERD.
GI symptoms
Exactly,
and gives you long-term
Yes,
problems,
yes,
right?
yes. So
now,
they need to avoid.
a last word about drug-induced stomach upset. Are there any drugs which you have come across which always cause stomach upset?
Yeah, the
when you
most
want to-
commonly used, most common culprit will be the painkiller medication.
Painkillers.
Yes. So this diclofenac or whatever, the pain medications
And what do
taken
you
for
tell the
various
patient? It should be
reasons.
taken after food or before food, when or with food?
Pain medication, sir? Yeah, definitely after food.
Pain medication always safer
Not
to
to be
take
taken
after
on
food.
empty stomach.
Okay.
As far as possible, avoid it. But then if it's necessary, absolutely necessary, then try to take it after food so that that side effect profile will be a minimal thing. And keep it a short term, this thing, whatever pain medications are, don't take it on a long term basis, months together. And if the pain, whatever the reason the pain is there, try to consult your doctor and take his advice, try to avoid these medications as such. If at all we are dealing with a long-term history of use of pain medication, we should try to add medication which will reduce the dyspeptic symptoms. For example, taking an antacid preparation along with the pain medication will decrease the symptom.
We have not spoken about smoking.
Yes.
Now, smoking is another factor. Smoking, along with all the factors of stress mentioned, does cause a lot of acidity, and sometimes it can be associated with a cancer.
Right.
So, could you kindly tell them about cancer in the GIT and the effects?
Right. So smoking.
How does you diagnose a cancer?
Yeah. So smoking, long-term smoking, I can say, smoking for maybe more than 10 years or so, a regular smoker can definitely have gastric issues. It can lead to stomach cancers. First, it can lead to an ulcer, first thing, and that ulcer can turn into a cancer. And apart from, before going to cancer, the patient may experience many other symptoms like, severe acid reflux kind of things. He may have difficulty swallowing, dryness of the mouth because of the nicotine content in the smoke. There can be, decreased secretion of saliva, which is essential for the food to, for the patient to chew and swallow the food. So these difficulties do arise long before the cancer comes. So if we pick up these symptoms at an early stage and ask the patient to stop smoking, I think more dreadful diseases can be prevented.
Absolutely correct. So, friends, as you have seen, it's been proven that stomach is a mirror of the face. Whatever the person is going through in terms of grief or upset or anger or rage, it's always reflected in the stomach. And to aggravate that time with smoking, coffee, late hours and bad food can lead to a worsening situation. So, in case you have got any further doubts or questions to ask Dr. Bharani, you are welcome to write in the column below or to meet Dr. Bharani in person at Apollo Hospital, Secunderabad, where she is practicing every day. Thank you so much. Thank you, Dr. Bharani.
Thank you,
for
sir.
coming.
Thank you.